Hi everyone! I hope you're all doing well and are safe. Welcome back to the next episode of Cancer Behind the Scenes as presented by Cancer Together. In today's video, we'll be learning more in depth about surgery and cancer treatment. Here's just a short reminder. Make sure to check the official Cancer Together website for any updated information on this series, to watch the YouTube video when it drops, and to play the educational game, which in this case is a Kahoot, to help retain the information in a fun, interactive way. Before we get into any new content, let's just revisit the previous video and recap briefly. Last time, we went over some of the factors involved in deciding a treatment plan and had an overview to some of the most common treatment options, but we didn't really cover each type of treatment extensively. So for the next few videos, we'll be learning about each form of treatment we mentioned in the last video more in depth. And in particular, we'll be focusing on surgery for today's video, so let's continue. So as we learned last time, surgery, also known as tumor removal or curative surgery, is used to remove the tumor and some of the margin around it, and it can be used as the only treatment or be used in coordination with other treatments too. Continuing off with that, surgery is an operation to remove part of the body to either diagnose or treat cancer. It can be used for a number of purposes like removing tissue at a high risk of developing cancer, to study if the cancer growth is benign or malignant, to determine how much cancer has progressed based off its size and if it's spread to the lymph nodes. Additionally, it can be used as a primary treatment if the tumor is localized, used to debulk or remove as much of the tumor as possible, and even to relieve symptoms caused by the tumor, like if it was pressing on a nerve or a bone. Traditionally, to sum it up, the purpose of surgery is to cure cancer by cutting into the body and removing all the tumor, along with some of the healthy tissue, to ensure that all the cancer has been removed. Additionally, some lymph nodes can also be removed to determine if further treatment is needed, but impacted tissue doesn't always need to be removed completely and can be done instead partly. So there are a number of different types of surgeries that can be used to surgically remove cancer. Cryosurgery is when cold material like liquid nitrogen or a cold probe is used to freeze and kill cancer cells. Electrosurgery applies high-frequency currents to kill cancer cells. Next is laser surgery, which uses high-intensity light beams to shrink or vaporize cells. And then Mohs surgery removes cancer from sensitive areas and assesses just how deep into the tissue the cancer is. In this type of surgery, the procedure is that one layer of the cancer is removed with a scalpel, evaluated under a microscope by a doctor, and then the whole process repeats itself again and again until all the abnormal cells of the tissue are removed and the margin around it shows no signs of cancer. Next is laparoscopic surgery, which is used in diagnosis, staging, treatment, and symptom relief. In this type of surgery, several small incisions or cuts are made into the body, and a tiny camera and surgical tools are inserted in as surgeons watch what the camera sees. By using smaller incisions, faster recovery and lesser risk of complications are ensured. Robotic surgery is used to help surgeons operate in harder to reach areas. Sitting away from the operating table, surgeons use hand controls to tell a robot how to remove surgical tools to perform operations as they watch a 3D image of the area being operated on a monitor. And last but not least, natural orifice surgery, a treatment still being experimented on, is utilized to operate on organs in the abdominal area without cutting into the skin by passing surgical tools down a natural opening like the mouth. An example of this would be a surgeon passing tools down the patient's throat to the stomach and then making small incisions into the wall of the stomach, into the abdominal cavity where either a sample of the liver could be taken or the gallbladder, which is another organ, can be removed. With this form of surgery, doctors hope that it can reduce infection, pain, and other complications. I know that was a bit much to let sink in at once, so let's put a visual to some of the types of surgeries. The first one you can see here, you can tell is cryosurgery, and you can tell since something cold is being inserted in to kill cancer cells. The next one here, a little less obvious, is of electrosurgery. Then here's laser surgery, as you can see, uses high intensity light beams. Moss surgery is here, since you can see that there are different there are different layers that are each being removed and then examined, and then it's going to remove again. And then the next one here is laparoscopy, which you can tell since there are small incisions that allow the cameras and tools to go through. And last but not least is natural orifice surgery, as you can see tools being brought in through the body through a natural opening to operate inside the body without any incisions on the outer surface of your skin. With regards to the timeline of a surgical event, in the weeks leading up to the surgery, you should expect to undergo different sorts of tests like blood or urine test or x-rays or other imaging tests to assess surgical needs and to prepare for the upcoming surgery. During surgery, anesthesia will be used as a medicine to block the feelings of pain while being operated on. The options for the type of anesthetic depend from one operation to another, so it's not always clear-cut defined already ahead of time. And then after the surgery comes the recovery period. Depending on the type of surgery, you might need to stay in the hospital some time and be monitored carefully. Your healthcare team would give instructions for recovery upon discharge time, for wound care, food and activity limitations, medication, etc. And I believe that's a good place to stop for today. Thank you for joining us for this video, and I hope it was informational and interesting for you all. Remember to play our educational game to review the information in an interactive way and to keep an eye out for when the next video drops. Thank you all again, and have an amazing day.